Olivia's story: the importance of self-advocacy. In the bustling streets of Rome, Olivia, a spirited and adventurous woman from Spain, found herself immersed in the history and charm of the ancient city. She was 29 weeks pregnant, a fact that only added to the magic of her Italian holiday. However, as the days unfolded, Olivia began to experience an uncomfortable itch on her arms and legs that she couldn't ignore. At first, Olivia attributed the itch to the change in environment or perhaps a minor allergic reaction. But as her weekend getaway continued, the itching intensified, and by the end of the trip, she was covered in bruises and broken skin from the constant scratching. Concerned for the well-being of her unborn child, Olivia decided to seek medical attention as soon as she returned to Spain. She visited her local clinic and described her symptoms to the doctors. They conducted a series of tests, including liver enzyme screenings, to assess her condition. However, the results were within the normal range, which led the doctors to believe that her discomfort was most likely a typical pregnancy symptom, made worse by the travel and different climate. They diagnosed her with atopic dermatitis and suggested she moisturize more frequently. Olivia left the clinic feeling frustrated and uneasy. Her intuition told her that something was amiss, and that her symptoms were more than just a routine pregnancy inconvenience. Late one night, Olivia stumbled upon information about intrahepatic cholestasis of pregnancy, or ICP. The symptoms described were eerily similar to what she was experiencing, especially the persistent itch and the discomfort that seemed to escalate at night. Armed with this newfound knowledge, she felt a renewed sense of determination to advocate for herself and her baby. Olivia sought out a private laboratory that performed a more comprehensive test for ICP, a total bile acids level test. At the laboratory, the technicians were compassionate and understanding. They conducted the specialized test she requested, acknowledging her concerns and empathizing with her situation. The results confirmed her suspicion. Her total bile acid levels were elevated, a clear indication of ICP. Armed with this concrete evidence, Olivia returned to the clinic she had initially visited, this time with a steadfast resolve. She shared the results of her private testing with the doctors, who were surprised. Recognizing the gravity of the situation, they revisited her case and confirmed the diagnosis. Olivia's pregnancy journey took on a new dimension from that point forward. She underwent more frequent checkups, ultrasounds, and meticulous monitoring of her liver function and bile acid levels. The journey was not without its challenges, but Olivia faced each obstacle with her unborn child's well-being as her unwavering motivation. At 37 weeks, Olivia was induced and gave birth to a healthy baby boy, her heart swelling with love and relief. As she held her son in her arms, Olivia knew that this journey had forever shaped her understanding of motherhood, resilience, and the boundless love that comes with bringing a new life into the world. Olivia's story shines a light on the power of persistence and self-advocacy. It demonstrates the importance of trusting one's instincts and seeking answers when faced with uncertainty.